Welcome to Ellie Scrubs In. Today, we're walking through a combined tonsillectomy and adenoidectomy, or TNA, a common ENT procedure performed for recurrent infections or obstructive sleep apnea, particularly in children. Let's scrub in. Step 1. Patient positioning and exposure. The patient is placed supine under general anesthesia with endotracheal intubation. A McIver or Crow-Davis mouth gag is inserted and suspended to expose the oropharynx and hold the mouth open. The tonsils are visualized in the tonsillar fossa, located between the anterior and posterior pillars. A nasopharyngeal mirror or endoscope may be used later to view the adenoids. Pearl. Proper mouth gag positioning avoids tongue compression and helps reduce venous congestion and bleeding during dissection. Step 2. Tonsillectomy dissection. Grasping the superior pole of the tonsil with an allus or tonsil forceps, dissection begins at the junction of the tonsil and capsule, using either monopolar cautery, cold dissection with scissors and snare, or radiofrequency ablation. The plane between the tonsillar capsule and pharyngeal musculature is followed downward to the inferior pole, taking care to remain within the avascular subcapsular plane. Pitfall. Entering too deep risks injury to the pharyngeal constrictor muscles, increasing the risk of post-op pain and hemorrhage. Once freed, the tonsil is removed, and bleeding points are controlled with electrocautery, suction coagulator, or hemostatic agents and sutures in selected cases. The same process is repeated on the contralateral side. Step 3. Adenoidectomy. After tonsillectomy, the mouth gag is repositioned, or a nasopharyngeal mirror is used to visualize the adenoidal pad on the posterior nasopharyngeal wall. Adenoid removal is performed using a curved adenoid curette with a guard or suction electrocautery for a more controlled hemostatic resection. Tissue is removed in a scraping downward motion, often in multiple passes. Caution: avoid overly aggressive curettage to prevent injury to the eustachian tube openings or excessive bleeding from the pharyngeal venous plexus. Hemostasis is achieved using suction cautery, topical vasoconstrictors, or pressure and hemostatic agents. Step 4. Final inspection and hemostasis. The oropharynx and nasopharynx are suctioned clean, and the entire surgical field is inspected for residual bleeding or tissue. No sutures are usually required. The mouth gag is removed, and the patient is awakened from anesthesia with care to minimize coughing or straining, which could dislodge clots. Postoperative care. After surgery, patients are monitored for airway patency, pain control, and hydration status. They're discharged with instructions to eat soft, cool foods, maintain good hydration, and avoid spicy, crunchy, or acidic foods. Straws and vigorous gargling should also be avoided. It's normal to have throat pain, referred ear pain, and low-grade fever for several days. White slough over the tonsillar beds is part of the normal healing process. Parents and patients must be warned about the risk of delayed life-threatening bleeding, typically between post-op days 5 to 10, when the eschar starts to slough. This is known as secondary hemorrhage, and in rare cases the bleeding may come from a vessel concealed by a large organized clot, sometimes referred to as a coroner's clot. If this clot dislodges suddenly, it can result in profuse arterial bleeding, aspiration, or airway compromise, a surgical emergency. Any spitting of fresh blood, coughing up clots, or bright red bleeding warrants immediate evaluation in the emergency department. Final thoughts. Tonsillectomy and adenoidectomy remain essential tools in the surgical management of pediatric sleep apnea, recurrent infections, and chronic airway obstruction. Though often considered routine, these procedures require precision, anatomical familiarity, and meticulous hemostasis to ensure safe outcomes, especially when performed in young children. Whether you're assisting, observing, or preparing to perform your first TNA, understanding each step and its risks is key. Thanks for scrubbing in with us. Be sure to explore more ENT and general surgery walkthroughs right here on Ellie Scrubs In.